Hi everyone, I'm Daniel Williams, Senior Editor at MGMA. Welcome to the MGMA Insights Podcast. Today's episode is a special one as we celebrate a major milestone, 100 years of MGMA. Since 1926, MGMA has been a trusted leader in medical practice management, supporting healthcare leaders through a century of change, innovation, and growth. As MGMA marks its centennial in 2026, this moment is about more than reflecting on the past. It's about reaffirming our purpose, advancing medical practice management, advocating for our members, and helping shape the future of healthcare delivery. 100 years of leadership, relevancy, and trust is something to be proud of, but it's also a reminder that the next 100 years start now. And they start with our members. To help us reflect on MGMA's legacy and look ahead to what's next, I'm joined today by two leaders who bring both history and vision to this conversation. Dave Gans, a national authority on medical practice operations and health systems for MGMA, along with Akash Madiah, MGMA's interim CEO, who is guiding the organization into its next century. Welcome to the show. All right. Well, Dave, welcome back to the show.
Thank you very much. I'm glad to be here.
Yeah, we had you on recently as a Lifetime Achievement winner, award winner for MGMA. Today, we're going to be talking about the 100-year anniversary of MGMA. And so who better to talk about this than you, Dave? You have a storied history, both as an employee and as a member. So just, again, want to welcome you into the show.
Well, thank you so much. I appreciate being here. Also appreciate the opportunity to give perspective on what it was like for me being part of MGMA and now being a life member.
Yeah. Well, let's look at that, your career and how it coincides with MGMA's different milestones, because I was telling you offline, I started in MGMA a little later than you did. I started in May of 2018.
You're catching up.
I know, I'm catching up. I'm catching up. And when I was preparing and researching MGMA before my interview, when I did searches, Dave Gans kept coming up. And one thing in particular, you had done a podcast interview. It was the very first MGMA podcast where you were interviewed about the history of MGMA. When did you become what is likened or called a historian of MGMA? When did you start really digging in and learning the history of it?
Well, actually, I'll look at MGMA's 75th anniversary, which was in 2001.
Okay.
And at that time, I was asked to write a column for the MGMA magazine, newly renamed the MGMA Connection.
Okay.
Because the Connection's topic was the 75th anniversary. Okay. So I was asked to talk about how things have changed in the 75 years since the first meeting, which was in 1926. That first meeting, very fortunately, had a proceedings. So they had a stenographer and did a verbatim proceedings of what occurred at that meeting. And I've gone back to that many times to look at how much has changed and what hasn't.
Right.
Among practice administration. And it's most interesting that the core concepts of being a practice executive have not changed.
Okay.
You're still doing the same job.
That's amazing. We're going to dig into that a little bit deeper. Let's back up and just share with our listeners your relationship to MGMA. We've talked about it in other podcasts, but someone may be listening to the MGMA podcast for the first time. When did you make your introduction to MGMA? When did you start as an employee?
Well, in 1978, I went to graduate school at the University of Colorado for a master's in health administration. And we had a summer requirement for a 12-week internship.
Okay.
And I had just a real interest in group practice management, doctors and administrators working together for patient care.
Mm-hmm.
So I said I had real interest in group practice, and Dr. Leland Kaiser, who was our program director, suggested, well, I've got friends at an organization here in Denver called MGMA. Let me call them and see if they can have it rule for an intern. So that summer, I did a 3-month internship in the MGMA Research Center, mostly working on analyzing a survey of academic practices and their needs. I attended the 1979 annual conference in San Francisco at my expense as an attendee. Well, I was looking for a job.
Yeah.
And following that meeting, continued to work part-time, and then March of 1980, I was offered a position to direct a grant from the Robert Wood Johnson Foundation.
Okay.
And I've been with MGMA as an employee since that March 1980 until I retired in March 2022.
Okay.
So I was an employee for 42 years.
42 years as a historian.
As a historian since the 2001
Right.
annual article I wrote on what has changed in group practice.
Right.
Yeah, and actually I just redid the article in a new concept looking at the financial aspects. Wow. Because, in 1926, we had, I think, 32 administrators got together, Madison, Wisconsin, had such a good time.
Yeah.
They decided that let's meet again next year.
Okay.
And we have needs that go beyond just discussion. We need to do a survey. Well, they surveyed practice costs, overhead, staffing levels, collection percentages. I mean, key concepts of managing a practice today.
Yeah.
So I just wrote an article for the MGMA Connection, the data mine, that is published in the April issue, and it's titled A Century of Progress. But it's a question mark.
Question mark, yeah.
Because, many things have changed. Clinically, on a medical perspective, medicine is completely different in 1926.
Okay.
From a practice management perspective, there's been far fewer changes. So the century of progress is true. We have new ways of managing medical records.
Right.
We have new ways of managing revenues in the practice. We have new ways of trying to reduce our administrative costs. And we have new ways of increasing those costs.
That's right.
So the role of the administrator is doing that management aspect, and that hasn't changed.
When was the decision made to move it out to Colorado? And were there other moves in between there?
Okay. MGMA existed as a member organization without staff until the early 1950s. And at that time, the decision was made. They had created a journal, and they had been issuing at the time the bulletin of the National Association of Clinic Managers. Okay, and which soon after became the Medical Group Management Association on a name change. Okay, and the editor of that was a man named Ed Stevens, and Ed, in I think it was early 1960s, that the growth of the annual meeting necessitated having somebody to manage that on a full-time basis, as well as managing the journal. So the board of directors of MGMA hired Ed, who had been the editor of the journal, to do both those jobs out of where he lived at the time, Silver City, New Mexico. So Ed managed for about 2 years, and then the board made a decision that as Denver was becoming more of a central healthcare place, in the United States, for centralized for the Rocky Mountain region, that Ed could move to Denver.
That is so cool. Thank you for sharing that. I mean, there's so much history in this organization, but I want to come back to something that you said. You were talking about that Lifetime Achievement Award. You said how personal it was. And when you talk to individual MGMA members, it's personal. You know, it's their practice that they're working at, but when they get together in those group settings, whether it's a webinar, whether it's one of our annual conferences or spring conferences, they're sharing those personal stories and they're seeing how they're connected. They may be in New Mexico, they may be in Denver, they may be in Mississippi, wherever they are, but they're finding that connection. You being with MGMA in one form or another since 1980, you've seen that firsthand. I think you just had an opportunity to talk to a new member. What was that experience like, getting to talk to someone in that capacity?
Well, this is the opportunity to share my experience and my understanding of what happens in a practice, and how in this case, how she can improve her work and also look at her career choices in the future.
Right. Thank you for sharing that. And I wanted to get back to those connections you make, because it is made up of people. It's a member community and a member association. So when you're hearing those stories or you're sharing your own knowledge, what is that like to you when you get to play that mentor role and you get to share the history of MGMA or the tools and processes and the data of MGMA with somebody else? What is that like to you?
Well, MGMA has always had a culture of sharing. And the first meetings exemplified that culture, where people, they traveled by train for days. In other words, there are people attended that first meeting from the East Coast, from the West Coast, and they met centrally in Wisconsin. But, when you travel for a day or more to get together, and what did they do? They talked, and they shared, and then following that meeting, there's evidence of communications, the newfangled telephone. How to use communications in your organization.
Right.
And they talked about that.
Yeah.
Yeah. Also, I remember I mentioned how for the first 30 to 40 years, it was completely member-oriented, run by members without a staff.
Okay.
And even now that we have a professional staff, so much of the organization is member organized.
It really is.
And focused on the needs of the member by the members.
That's right.
And their opportunity to share their knowledge with others. So what I've been doing is the same.
Yeah.
It's the model I grew up under with the organization.
I love that. Let's go back to that first meeting or those first years of it. When you think about MGMA getting formed, what was it really originally created to do? When you were just sitting down to write your Connection magazine article, when you think about that kernel, that first origin story, what were they trying to crack or figure out?
Well, part of the first meeting was recognition that people were not alone. Stepping back even further, the first group practice that we can look at we have a couple of early organizations. For example, I think it was Johns Hopkins, as a medical school, created its clinical organization, where medicine and surgery departments were created. Well, those are functioning, if you think about it, as group practices. Most people look at the original group practice was the Mayo Clinic. And this dates back to the late 1800s, when Dr. Mayo's two sons came to practice with him. And then a few years later, their reputation as surgeons and doctors was drawing people from around the state and regionally, and they added another doctor. As they expanded, they realized they needed an office manager. So the first business manager to manage the administration of the clinic was Harry Harwick. And MGMA looks back in the early 1900s with Harry Harwick and his contemporaries. And as I said, over time, in 1926, we had people got together in Madison, Wisconsin, and the first day looking at the proceedings was communication among themselves. They had speakers, but it was to realize, that we are not islands.
Yeah.
That we care common issues, and we have common solutions, and we can learn from each other.
Right.
And that was what prompted the concept of having future meetings, a meeting the next year in Minneapolis.
Let's think about the evolution now. We have seen, you were telling me, that history of Mayo and Johns Hopkins and other original formation of groups. We've seen a lot of changes of group practices, acquisitions, mergers, all the things that have happened, and the advent of technology, so many different things that have come into play. So when you think about that, what is different, and how has MGMA helped practice leaders navigate those changes over time?
Okay. Much of what we think is new is not. The problem existed. We have some different aspects of the original problems. They're communications. When I did a little bit of background research, I've got an interesting aspect which had to do with why a group practice differs from a hospital.
Okay.
And I'm going to read a short thing from Harry Harwick, the administrator of the Mayo Clinic, and one of MGMA's founders, that said, "It seems to me there are one or two things that we run into in clinic and hospital administration, and one of these is the tendency of the business administration becomes separated from the professional side. This is particularly true in hospitals. There seems to be a constant war on between the hospital superintendent and the professional staff. And I think there's somewhat that tendency creeping into group practice around the country. I think it is important that there should be very close recognition of policies between the administration and professional staffs. And I think that is the most, to me anyway, seems the most important thing in the present practice of group medicine. I think we must all recollect that after a group is primarily formed to practice medicine, and a group is no bigger than its professional staff, there should be a close, harmonious feeling between the administration and professional staff. It's really fundamental. And I come back to think that defines group practice better than almost anything else I can think. Oftentimes in a hospital environment, there is an antagonism between the professional physicians and nursing staff and administration. And in the best group practices, the best well-run, that doesn't exist. It's a team. Yeah. So, and again, this comes back to some of MGMA's early concepts and core values.
Right.
One of which is team managed care.
Yeah.
It's the physician administrator collaboration that improves care for the patient and improves the organization's practice itself.
I wanted to follow up and ask you something. You have been giving us a history of MGMA going all the way back to 26. When you integrate your history going back to 1980, I love your stories because you've got wonderful stories. When was there a moment when you realized this organization that I've been a member of and now I'm an employee of, we're doing something right in this industry, doing something right for its members? What really stands out to you?
What was the aha moment?
Yeah.
I can't think of a single moment, but I can think of multiple times. And oftentimes it was during having a committee meeting with members. And, of course, they're discussing their issues. And, again, I come back to think that, we are not in this as individuals. We're in this profession as a group. And MGMA is binding people together and enabling them to communicate and share. And, other times I've had, for example, if I was at the annual meeting and at that conference, I would sometimes have a presentation, or sometimes just be staffing the association's booth, and having members come up to me and say, "David, I really liked what you did." I go, "Oh, okay." What did I do?
What I do now?
and they realized that they had taken information that I had written in one of my articles, or they'd taken the surveys that I was managing at the time and using them to improve their organization. And they said, "You made a difference." Yeah. Or, "You saved my job." Or they said, "I got a promotion. You and MGMA made a difference." Yeah. And you come back and you say, that did make a difference. And even though it was a difference to one person, that was that person, but there are many others that made a difference as well.
Yeah.
Yeah.
Wow. That is so good. I've got a final question for you. So when you look back at MGMA you've done a lot of research. Mm-hmm. When you look back over that 100 years, if we put a stamp on things right now as we start moving into the next 100 years, what's the legacy right now of that first 100 years of MGMA?
Well, part of the legacy, I think, is that, the core values have not changed, and they're ongoing. That, it's patient-focused care. The administrator functions like the nursing staff, like the administrative support staff, like the physicians, focused on what is the needs of the patient, okay? And how can that patient have the care they need? From an administrative perspective, that may mean making sure that you have the necessary insurance approvals for that patient to receive the care that the doctor is ordering. Mm-hmm. It's having the role of the administrator as part of that physician administrator team that includes the nursing staff and includes, the other clinical staff in the practice to focus on care of the patient, and to do so efficiently in a way that sustains the organization. So that's the role of the administrator. And that's the role of MGMA, is how do you do that? How do you facilitate that? How do you give the tools to its members so they can do their jobs in a better way?
Dave Gans, lifetime MGMA member, MGMA historian. I want to thank you so much for sharing these insights about our organization today. Thank you so much.
Well, thank you for the opportunity. MGMA obviously means so much to me. Yeah. I've spent half my life with MGMA. That's right. In a good way, a very good way. Thank you.
Thank you. That was great hearing from Dave Gans about the history of MGMA. And now we'll talk with Akash Madiah about celebrating the past 100 years and looking ahead to the future of MGMA. Akash, welcome to the MGMA podcast.
Hey, thanks for having me for the first time, Dan.
I know. We have got to do better about getting you on the show. So
appreciate it.
Yeah, we're here talking about the 100-year celebration of MGMA. But first, we want to get to know you a little bit better as well. You started. I looked this up on LinkedIn. I know that we started roughly the same time. You started in October of 2018.
Yep.
You came in as CFO?
I was CFO, yes.
All right. What was your relationship to MGMA before you became an MGMA employee? Had you heard of the organization? Were you a member? Anything of that nature?
Yeah, it was funny to me, I guess, story about right before I came to MGMA, I worked in a medical practice. I was a CFO there, and I used MGMA data. We were redoing all our comp plans for our doctors, and I used MGMA data. I got a call from a recruiter to come interview at MGMA, and I didn't realize MGMA was down the road from where I lived. And I actually went to high school on the same street that MGMA, where the building is, and I didn't know it existed, which, again, we're talking about the 100 years.
Yeah.
So kind of luck, and it was an opportunity to come to an organization that I knew, because I had used their resources for the comp plans and other resources for just helping us manage day-to-day life of medical practice problems, I guess.
Yeah.
So, so that's how I came.
Yeah. So that is a great story because for so many people in healthcare, data is that entry point for MGMA members. They get to know it. Were you a member, or were you able to just you had the data and then you were using it that way?
Our organization was a member.
Okay.
As a CFO, the redoing comp plans, I didn't know about all the things that MGMA does.
Right.
Somebody gave me the data and I used it and helped redo the comp plans. But coming to MGMA and understanding the offerings that we have, I think it's a big opportunity for us as we look into the future. Like, how do we tell people about all the cool stuff that can actually help them in their day-to-day life?
Right. I think the 100-year celebration is a great time to bring awareness to all the different products. A lot of people, because I talk to a lot of MGMA members, and they know MGMA as that data company. That's where I go for my data.
People, right?
The data people. That's where I go for my data. And I go, yeah, but we have a podcast too, though. You know, we have webinars, we have books, we have tools, we have resources, we have all these things for you. And that's a lot of what we're going to be celebrating and bringing awareness to over the rest of this year. So let's look at it this way then. What does this 100-year milestone mean to you? You are our acting or interim CEO, however we want to refer to that. And we are so glad that you are leading us into this 100 years right now. What's the milestone mean to you in this executive role?
Yeah, I think other companies celebrate their 100-year. What does it really mean?
Yeah.
Like, I think in our meeting the other day, somebody said 0.5% of companies make it to 100 years.
That's right.
0.5%, right?
Yeah.
And so that's amazing for MGMA. But what does it really mean? It's an opportunity to reflect, what have we been doing for 100 years? And I think we've been a valuable resource for medical groups, and we've always stayed true to our mission of advancing the business side of healthcare. And again, 100 years is just a number, but then you think about let's reflect on the past, what we did well, and how do we move to the future? How do we think about how we can make it to 200 years, right? Because I don't know what percentage of companies make it to 200 years, right? United States of America, right?
Right.
So I think that's what it means to me is we've had, when I talk to members or talk to people that have longtime members or people that have been involved with MGMA, they always talk about what MGMA meant to them and their careers and how it helped them just navigate administrative burden, or even thinking about going back to COVID, what our advocacy team did for our members and groups. And I think that's the stuff that I just kind of continually think about. It's a time to be reflective and think about how do we keep this going.
Yeah. You brought up something really important, that it really is about people. It's a member organization.
Absolutely.
And for some people like you, prior to your role at MGMA, it was something to go in and access data and make your practice better. And what we, again, want to do is bring the awareness of the other things that MGMA offers to people. You and I connected in Charlotte recently at the MGMA Operations Conference. I just think there's a special energy when you get to go to a face-to-face event. I know that's not accessible to everyone due to their role in their organization, but when you go to one of those face-to-face events, whether it's financial conference, operations conference, or our upcoming annual conference in San Antonio,
don't forget private practice.
Thank you for reminding me that. And just very shortly, we do have the private practice conference coming up as well. What do you get out of that when you're there face-to-face with some of those MGMA members and feeling that energy and hearing their stories? What's that like to you?
Yeah, I think for me, I worked on the medical practice side 8 years ago, right?
Yeah.
And I think it gives me a lens to understand what they're going through. But 8 years ago now is a long time ago, right? And so my experience isn't necessarily relevant. There's always going to be the evergreen items of how do you collect the money? How do you understand payers and payer contracting, or how do you deal with the administrative burden? But being in those face-to-face conversations, both with the vendors and the people that come to the conference, understanding their problems and understanding, because you said it, we're a membership organization, right? How do we solve the members' problems that they're coming to us for? And so if we're serving up old content or serving up old things that were relevant 8 years ago, nobody's going to keep coming to us. And so understanding and just having conversations. And of course, we have internally at MGMA, we have a better way of collecting that data. But for me, it's valuable just to have what are you dealing with kind of conversations. So.
Yeah. So you brought up it needs to be, we need to be of the time. It was funny that I was talking to Dave Gans earlier in this interview.
Mr. MGMA.
That's Mr. MGMA right there. 42 years of association with MGMA as an employee, and then beyond that as well. He's done the history of MGMA, looked into it, and seen that we do have some of the same challenges that we've had for 100 years, but we look at it through a different lens or different ways to problem solve. So what is MGMA doing? What is, from a strategic standpoint, how are we addressing some of the challenges that the practices and practice leaders are having right now?
Yeah. I mean, working inside MGMA, one of our key principles is put our customer and member at the center. Right. And so everything we do, we want to make sure how do the members and people that aren't members that just come to our conferences or buy our data, how do they think about MGMA? I mean, I would love if people, when they have a problem in a medical practice or an issue, the first thing that pops in their mind is MGMA. Yeah. And part of that is just understanding if people think about data, how do we make our data better? Yeah. If people think about conferences, it's like, why do I want to go to this conference? Like, I don't want the same conference that I was served last year. Like, what's the issues of today? And how do we continue to just process those same challenges? And we're not always going to get it right. I acknowledge that. But if we continually start with what does the customer think about us? What does the member think about us? And how are they thinking about the problem? And, part of the power of MGMA is the network. Yeah. And when you have the power of the network, you have other people that are solving the same problem. And some people are solving it really well, and you got to be able to access them. And when you're in the same community, you have access to that. So yeah, I think, did I answer your question?
You sure did.
Okay.
And I love that you brought up network again, because what I do when I go to a conference and interact and engage with the MGMA members, I ask them, what brought you here? Why are you here? We're glad you're here. Yeah. We're really glad you're here, but what brought you here? And we hear a multitude of answers of that question. For many people, they have a particular problem they want solved, or they want a different lens or a different insight into that problem. For many people who come back again and again and again, it is really that network. Just to know that I'm not alone, that there are other people that are dealing with some of the same challenges and other things. They might be somebody might be from Miami, somebody else might be from Alaska, but they've formed bonds and they just love seeing those same faces and interacting with those same people every year. I want to talk about that one more time before we switch gears. That it really is a people business. And so anything you might want to share about that? You were just in Charlotte. You're about to head to, where are you heading soon? To St. Louis for?
St. Louis for the
private practice. Yeah.
I mean, that's what I opened the ops conference with. The most valuable thing you might get here is those hallway conversations, and over lunch, and just go get a casual meal with somebody, right? And everybody's dealing with, there might be different regulations per state or different things that people are dealing that are very specific to them. But in general, how do you use AI? How do you think about scheduling? How do you think about moving to value-based care? Like, these are big healthcare type issues, and nobody has it figured out 100%, right? And so getting those best practices, and just, you can listen to a speaker on stage. Yeah. And I, as I've said, I think some of the speakers we have at our conferences are excellent, but the thing you really remember is connecting it with that personal connection. I think that's the stuff that really sticks.
Yeah. So we are going to switch gears because we did something really cool at MGMA earlier this week. The marketing team and yourself, y'all unveiled a new logo,
Yep.
Reflecting that 100-year milestone. Talk about I don't know how deep you want to go into the design of it, but
Yep.
what that means as we move forward. We celebrate the first 100, but we move into that next 100.
Yeah, and I don't know how many people have seen this logo. I think it's really cool. Obviously, all the work that goes into branding and coming up with a logo, I think nobody sees all the behind the scenes work. And you said it, our marketing team and brand team did an excellent job. And to me, you have the 100 out there, and it's an infinity sign, really signifying continuity. Again, honoring the past, and we're going to keep going. We're going to keep advancing the business of healthcare. And so all those little details and marketing things will have elements of like those forward arrows. And there's no way I can explain it as well as our team did on Tuesday, but I think it's been received well in the first couple of days that we've unveiled it.
Yeah. So for anybody listening, I hope they'll go out to their social media channels and see it on our MGMA flagship accounts. You'll see that on LinkedIn and other places as well. You did bring something up, though, that infinity sign, it does show it's rolling from the past, the present, the future. And that's something that you and the executive team and other leaders at MGMA are thinking about right now. How do you celebrate what we've done, but then continue to evolve, continue to innovate, and help medical practices thrive in a difficult environment? Yeah.
What Dave said is there's these problems that have been probably around for 100 plus years. That's why MGMA was formed in the first place, right? A place for people to come together and talk about these problems. But we know there's going to be new problems popping up, and we have to be able to talk to our members in a meaningful way, not just the person that calls our customer support team or the person that our sales team connects with. It's not one conversation here and another conversation there. Like, how do we continue to get feedback from our members and customers of like what they want to see? And, AI is just one example of like things are changing, not just for healthcare, for everything, right? And so how do we incorporate it in a way that is meaningful? Because it's a word like, just one more thing I have to worry about incorporating into my daily workflow, right? And people are tired of initiatives that go nowhere and vendor promises. And so we want to make sure that we're listening to our member and enhancing the things we do well, which is, our data. We're the data company. Our conferences, our advocacy group. Just earlier this year, I know he was on your podcast, Jeff Smith.
That's right.
Our incoming board chair talked to the Senate about administrative burden, and that was a lot of the work of our advocacy team to get Jeff in front of the Senate, right? And so, how do we do the things we do well already, but also think about what are the new challenges that members and customers are feeling, and how do we address them? I don't have the answer right now, but half the problem is knowing what the problem is, right?
That's it.
So we'll get there, but it is a shift, I think, in mindset of all right, what made MGMA great in the past is not going to make MGMA great in the future. We have to continually be looking to the future.
That's right. And that's where I wanted to go next. For many of us at MGMA, we're working day to day with members on what they're dealing with right now. You as an executive and the rest of the executive team, you're looking out into the future. So if you do that for the next decade, when you're thinking about that, what are some of the main priorities that MGMA is going to be focused on so they can continue to meet members where they are?
Yeah, I think it's continuing to just be outward facing. I think I can't talk to people just at MGMA and say, hey, what's the problem?
Yeah.
Right? We have to talk to our members at conferences. I talk to other associations in healthcare and say, what kind of things are you seeing? It's getting the whole scope of what issues are out there. And it's not obviously just me, it's other members of the exec team, it's you, on like understanding what people are bringing up in this podcast or in our feedback loops that we have that we're trying to make even more robust. Like, it's not just anecdotes. We want to get actionable insights from data. Like, what sessions are people really going to in conferences? And it's like, all right, so this session was oversold. This session was maybe not as important to people. Like, how do we tailor and find the right experts in the industry to speak at our conferences next time to address those things?
Okay. Final question then. If we imagine ourselves into the future and you're looking back at 2026, what do you hope the legacy is then of MGMA to its members, the impact that they've made?
I hope that people will remember us for advancing the business of healthcare. I said it earlier on the podcast, but like, when people have a problem on the administrative side or the financial side, the ops side of healthcare in their medical practices, the first thing they think of is MGMA. And we want to make it as easy as possible for them to access our data, access our website. You don't want administrative burden accessing MGMA's website, right? Like, how are we continuing to evolve and making our members and customers' life easier so they can, I mean, in the end, this is all about how does this country provide better patient care? And when you take the administrative burden off, doctors and care teams get to take care of their patients better, right? And you get so bogged down in writing another, dealing with another EHR or dealing with another initiative. You want to really boil it down to, like, how can we help? And are we going to continue to be helpful in the future?
All right. Well, Akash Madiah, acting CEO of MGMA, thanks for joining us on the MGMA podcast.
I appreciate you letting me be on, Daniel.
Thank you.
Thanks.
Thanks again to Dave Gans and Akash Madiah. Now, as we celebrate MGMA's 100 years, one theme is clear. This organization has always been about supporting medical practice leaders through change, and that commitment is stronger than ever. If you're ready to be part of MGMA's next century, there's no better place to celebrate than at the upcoming MGMA Annual Conference. For a limited time, MGMA members can register for the annual conference for just $100, a special centennial offer available through May 28th. Join us to connect with peers, gain actionable insights, and help shape the future of medical practice management. Visit mgma.com to learn more and register today. Thank you for listening, and here's to the next 100 years of MGMA.